Right, I'm not going to take up much of your time. I teach one course in veterinary medicine, that's renal physiology. And last year I spoke to Duncan because we found the same kind of problems between the medical students and the veterinary medicine students. And being course director of physiology, I'm always concerned about what do we teach our students? Can we really improve it? And how do I get this to
I
go?
want to go to the arrow.
So, we've been asking our students, we've been asking the clinicians are always complaining the students don't know anything when they come into their clinical years, although we tell them, we teach them. But the problem that came out very clearly when we started discussing with the students, with the TAs and everybody, is our students come to the M1 here out of a very competitive undergraduate school. And we immediately picked up that the huge problem is they study to get a good MCAT to be into medical school, and the way they do that is to memorize. Whereas the first thing we do with them in the M1 in the physiology is we don't want you to memorize. There's too much, there are too many facts that you can memorize. We want you to apply it. I'll give you a good example. They wrote an exam last week. So that everybody knew that if you look at listen to the second heart sound, it's split. There's a slight difference between the timing of the first and between the aortic valve and the pulmonary valve. There's a slight split there. So in the exam, I asked the question, under which of the following 5 conditions do you think will the split be paradoxical, turn around? Right? So all that, what we wanted them to do is realize what makes the aortic valve close. In other words, anything that's going to delay the opening of the atrial valve is going to turn the split. And the obvious answer was aortic stenosis, because there's too much resistance. The class did really poorly on that question. And simply a matter that they couldn't apply it. So this is what I've been talking about with Duncan a lot about this, and he's been very helpful. It turns out, you listen to the clinicians and say, what is the problem? Why does it take so long for a medical student to get to medical school, and in their 4th year they're still struggling? It turns out that there's one thing that takes a student from M1 basic sciences into the clinical years. It's something called a differential diagnosis. That is the huge thing, which is a problem for all my colleagues in the M2, M3, and M4 years. And it's my view, and I've been reading some articles about it, is that the students come in and they're not used to critical thinking. They're used to memorization. If you use memorization, you're not going to do a differential diagnosis very well. So we're trying for means to get them to use critical thinking very early on in their 1st year. And this is why Bill and Duncan was so useful for me. So what we do with the students who try and develop it is something that I've always had. Is we've tried all kinds of things like TBLs. I tried TBL once. I don't know if any of you do TBL. The students are supposed to do this, the class themselves, and we just sit there. It was absolutely chaotic, and nothing came from it. I tried flipping the classroom, I tried to be with it. It just didn't work. But the one thing that really works for us is a PBL. We give the student a problem. I don't even go through there, but this is now a typical problem. This is they're going to do this next week. It's a student. It's a patient who moved from New Jersey. I'm not sure where Hoboken is. I'm not even sure where New Jersey is. Anyway, driving to Colorado. She arrives in Colorado, and she developed breathing problems. So then you go through there, give the medical history for the students. We try and make it as clinically relevant to the students as possible, so everything they see here is what they will see in the clinics. We give them their examination over there, we give them the blood gases over there, all the data they need, and then we start asking them a number of questions. So this, up to last year, was our PBL. So I was hoping, can't we do something different? Because the problem that faces us is we give this to the students a week before the time, and then with our TAs we sit and we have about 5 minutes with the student to see what was your conclusion, how did you solve this case, and that's not enough time. Then I realized that if I use Will's approach with help of Duncan, we can let the students spend more time on it. So what do we expect then? And this is the rubric that we ask our students, or we're going to ask our students. So we tell them, okay, if you go through your case, if you look at it carefully, there are probably 2 or 3 correct answers. I say, hey, can you pick out the possibilities? And if you think you're right with the top 2 or 3 diagnoses, is it which concepts did you use to come to that conclusion? It's something that we'd like to know, because there are many approaches that they can use. What is the evidence? Was it appropriate for the diagnosis or not? And then just we'd like to know how well they organize their material. Because they listen to the clinicians, they always complain. A medical student and an intern that has to write up every report. And they say their reports are terrible. The students, my TAs tell me, they've been never taught what they should do for differential diagnosis. So we do it now in the first year, even without having a patient, unfortunately, then we hope we can help them. And at the same time, we can start telling them, this is how you have to organize your thoughts when you write out a cohesive report about a patient. And then finally, there's some science in there. We would like them to show us how they support their evidence. And then we just follow a rubric as everybody else, and there's 5 points. I think it's very similar to the one that Will has. So every rubric, we can analyze them at 5 different points over there. And then finally, we have some information collection and data. So we're going to review them all the time, and we're going to give them a moment, we're going to give them 7 days to write up their report, and in 3 days when they must do a final look at all the peers came in, look at their results, and then we'll see what's going to happen. And I think we're going to find the same thing as Bill has. It was, I had this problem last year with my TAs. We tried them to evaluation, and all they wrote is great work, wonderful, keep it up. And I wish all my students were actually great workers, but unfortunately they're not. But yeah, anyway, so I've got nothing to show you. Perhaps after next week we'll have, but this is why we're doing it, something very similar to what Duncan is doing. And we hope that we can really turn out a better doctor, because that's my big aim. I want to be treated when I go to hospital, I want to have a good doctor treating me there. And we have one, I didn't realize it, but we have one. Duncan has it much more difficult than we have. Our patients can talk to us. They cannot talk to us. Anyway, so I'm not taking up any more of your time, but this is where we're going, and I hope that with the help of Bill and Duncan we can do something useful.